Good morning, everybody. This is Scott McMeans with yet another episode of the Business Spotlight. And today I am pleased to have with us Dr. Andrew Hertz from the Zest Pediatric Network. And today we're going to learn a little bit about his story, the Zest Pediatric Network, and what makes it work so successfully. So, Dr. Hertz, please introduce yourself and tell us a little bit about what you do and how well you do it.
Thank you. Thanks for having me here this morning. Drew Hertz. I go by Drew. My formal name's Andrew. My grandmother used to call me that, but that was about it. And I am a pediatrician first and foremost. I'm a pediatrician. I grew up here in Cleveland, and I trained here, and I've worked here all my life as a pediatrician. My story is really simple. I've always wanted to help children, and I did that both as a general pediatrician. And then I was fortunate enough to be at University Hospitals, Rainbow Babies and Children's Hospitals, and always have some type of administrative role at the hospital. And during that journey, I started many new programs at the hospital and in the community. My first was a nurse telephone triage call center, which has grown into the largest call center in the country. That was a lot of fun starting that from scratch and becoming an expert in nurse telephone triage. We moved on to, I was fortunate to receive a federal grant, a large federal grant to establish one of the first Medicaid accountable care organizations, an ACO. We started that in, when that was, like right around when the Affordable Care Act was passed, we got funded for that. And I spent a lot of time creating innovative programs for children, especially those that were underserved, but also across the entire spectrum of patients that we serve. Most complicated patients to very healthy patients, trying to keep them even healthier. And then I started the Rainbow Primary Care Institute, which was a coordinated effort across all of the pediatricians that are part of the UH network. And then I even added on women's health before I left University Hospital. So I was overseeing all the community women and children services for university hospitals. And I had a blast doing all that, starting programs and helping doctors to better take care of their patients. It eventually came to the point, I had a great time doing that. And eventually I just felt that I wanted to try something else. I felt I was no longer really able to help doctors to take care of their patients. And I decided to leave the health system world and join the consulting world, where I could make an impact in a different place, not so locally, but maybe in other places around the country. On that journey, I came upon the direct pediatric care model. There was a local practice here that had started direct pediatric care, and we can talk more about what that is in a minute. And as I was helping them, we eventually decided that let's make a network of direct pediatric care practices, because we feel we can really help change the way care is delivered across the country by doing so. So we started Zest Pediatric Network. It wasn't always called Zest. First, it was called Thrive Pediatric Network. We got in a little bit of trouble with the name Thrive. There's some other people that own the name Thrive in the healthcare industry called Kaiser Permanente, and they didn't like us using the word Thrive too much. We came up with the name Zest, one of my partners, and I love Zest. It has really spoken to us much better, and Zest Pediatric Network was born. That's a short version of my story over the last 30 years or so. It's really all been dedicated to helping children and the families.
Well, I can say one thing, and this is for certain: an impressive resume spanning both the clinical and the administrative side, but the development of something brand new with respect to these networks on the consulting side. Drew, this is impressive. And what I found from listening to you, the heart behind what you're doing is taking care of children. And you said it in the first sentence, I believe you said, is I'm a pediatrician, but I always wanted to help children. And that seems to be the prevailing theme throughout everything you've done here, other than that little stint when you dealt with women's health for a little bit. Other than that, you seem to be very well focused on the children, which is, I would imagine, an underserved concentration or underserved specialty, simply because not every child has the opportunity to get healthcare. So talk to me a little bit about what makes Zest Pediatric Network such an interesting and special network for taking care of children.
Zest is special in the model in which we exist. It's called direct care. Direct care models have been around the country for about 10 to 12 years now, really started in the adult world, and it is flourished into the pediatric world, into specialty medicine, and in many other areas. What direct care means is that rather than having insurance in the middle, whoever is responsible for the healthcare payments are paying it directly to the doctor, not through a third party. So in essence, and the simple way to look at it is there's a flat monthly fee that is paid to the doctor, and then the patient receives unlimited access to care to that doctor. So you're taking out the burdens of insurance and the bureaucracies of insurance, and quite often the bureaucracies of a large health system, which has a lot of overhead and infrastructure. When you take away all the regulations and requirements and the insurance processing, the insurance processes, the overhead for the doctor goes down drastically, which means they can take care of less patients and provide a higher level of care. So that's the overarching business model. In direct care models, many different people can pay that monthly membership stipend. Some people call it an annual stipend, whatever you want, but different people can pay for it. Patients can pay it directly. Organizations can pay it on the patient's behalf. Employers can pay it, and insurance companies can pay it in a different model where they're giving you a flat monthly stipend or membership or capitation, whatever term you want to use. The point is the doctors are no longer striving for volume to pay their overhead. They're striving for relationships and quality care with the patients. You're taking out a lot of bureaucracy. So that is a step to the direct care model. And again, lots and lots of adult doctors doing this, internal medicine, family medicine doctors, pediatrics, some doing it about 5, 6, 7 years now. There are no networks of pediatricians doing this. They're all one-off pediatricians that are learning how to work in this model one at a time. And certainly they connect and they network with each other. Our goal at Zest Pediatric Network is to lower the barriers for doctors to enter this model and make it easy for them to do it. And we'll get into a little bit more about the vision of the whole network. But at the core of it is we want doctors to be able to practice in this model because we believe it'll save pediatrics, it'll revolutionize pediatrics and transform the way care is delivered. One more point, and then you can ask any clarifying questions you want. A lot of people call this concierge medicine and think of it as concierge. There is a difference between concierge medicine and direct care practice. Concierge medicine still charges an annual or a monthly stipend, allowing the doctors to lower the number of patients they care for, but they still bill insurance too. So they have to function within all the regulations of insurance. Direct care models, they don't have fee-for-service insurance payments. So there's a difference. Okay. There's an overlap, a lot of similarities. It's all trying to increase patient care. And I can get into a lot of the features of the direct pediatric care model and why it is helpful to families and patients. But that is the overall business model of direct care is what I gave to you. What it means to patients, we can go into later if you want to.
No, great explanation. I understand it, at least I do, as far as how it delineates from standard and what everybody has traditionally known for years on how their insurance company works to pay for their premiums or their care. I'm interested to learn, you've made comment that adult physician care has networks like this, but there's not a lot of pediatric networks like this. Is it possible that at one point they'll merge? So as a parent, I can take care of myself in this type of program, and then also have my child or my child involved in a pediatric thing. Is there going to be the future where you see these direct care models merge?
Let me answer that question in 2 ways. All right.
Please.
First, a clarification. There are what I call the adult networks, direct pediatric care or DPC. I'm sorry, direct primary care or DPC. That's the bigger term and the bigger movement. It's called direct primary care, DPC. We use direct pediatric care. Some of those are family medicine doctors that will see kids. Some of them go all the way down to birth. A lot of them will start at 5, but their focus is really on the adults, in my opinion. And the pricing for their kids is an add-on to getting the adults in the family. And maybe this is a time when I'll explain our whole vision. We are pediatric only and intentionally because we do believe that children need different infrastructure to focus on the early years. And the most important years in children are the first 3 to 5 years, mainly the first 3, and then the adolescence again, where kids are changing so rapidly. And different infrastructure and priorities are needed for that family. Family medicine doctors can certainly provide all the medical care there, but it's the wraparound and the emphasis on those early years and vaccinations and preventive care that we are trying to create a unique experience in at Zest. So I want to say this because the adult models, as I call them, sometimes do take care of kids. It's just not their only focus, our only focus. The premise of your question is, do you see the two merging? I do. Once we create and finish creating this unique pediatric experience, and we can prove that it changes outcomes, and we can talk about what those outcomes might be because there's many ways you could label the outcomes, then I think the adult and the pediatric networks may merge so that it's more of a one-stop shop. But we are very dedicated to children, as you've already heard, my co-founders and myself, and we want to make sure that we're providing a unique and distinctive pediatric experience.
Okay. I appreciate the clarification and explanation on all this. This is, like I said, it's so different from what people traditionally have been accustomed to because they get their insurance from their employer and they're told to go to this location and do all that. With the growing opportunity in this space, how is it that you see Zest Pediatric Network growing? What are your models to have it grow from where it is now in Northeast Ohio to everywhere across the country? How do you see that growing?
I'm going to answer that question in a minute because first I want to clarify something else you just said, if I may. Second,
please.
If you get tired of me doing that, let me know. But yeah, one of our biggest challenges is awareness of this model, because as you just said, people aren't aware of it, and they all say, "Well, I get my insurance, and my insurance tells me where to go, and I have insurance, and that's what I'm going to use." A lot of people say that. The question you have to ask yourself is, well, what is my insurance getting me in 2023? You're still paying, you have an out-of-pocket max, and for families that can be $5,000, $10,000, $12,000, where between their deductibles, their co-pays, their co-insurance, they have a lot of money at stake. So even though they have insurance, it's really for catastrophic illnesses because they have high deductible health plans or they have their co-insurance. And that's just my point. It is that families really need to begin to understand what their insurance covers. There's been a couple studies that I've been reviewing recently, 2 of them. One says 10%, one says I think 14% of the American public truly understand their health insurance. And we believe that health insurance should really be same as your auto insurance or your homeowner's insurance. It's for catastrophic problems. You don't use it for maintenance on your house or maintenance on your car or preventive maintenance on your car. And health insurance would be for catastrophic, those things that you expect you may need to pay separately than your insurance. So how do we expect to expand this model and grow? Zest Pediatric Network is what's called an MSO, a management service organization. So we don't actually employ any physicians. Each physician is their own corporate entity for many purposes. There are business reasons for that and entrepreneurial reasons. And they hire Zest Pediatric Network to set up their offices and run the office for them. We want doctors to show up and be doctors. When you go to business school, when you go to medical school, you're not going to business school, and they don't necessarily know how to run their own businesses, and that's even more so than it used to be. So we run the businesses, we set them up, we help market them, and we give them all the infrastructure. They have to go and be the doctors they dreamed about being in medical school, which they often cannot be that type of doctor when they work for some corporate entity. And as you know, 70–80% of doctors now work for some corporate entity. We think that we will be able to scale and grow around the country because we will have the infrastructure to allow doctors to excel in the direct pediatric care model.
Okay. So when you're looking for the opportunity to grow, what kind of physician, what kind of personality, what kind of traits, what are you looking for in the physicians that are going to be a part of Zest Pediatric Network? Is there somebody in particular that stands out among the others? How do you identify who is and who is not capable of working with you?
We want doctors who really want to save pediatrics or transform pediatrics and create a new model of care. People who want to spend a lot of time with each patient. A doctor who's willing to do home visits with their patients, which we can get into again as we talk about the features of this. People who are willing to go to their homes. People who are willing to be available to their patients basically 24/7. Doctors who are willing to just get a text message from their patients and answer it. And doctors who really want to develop those deep, meaningful, mutually trusting relationships with their patients. And that's not for all doctors. It really isn't. Those doctors that are willing to take maybe a little bit of a risk in order to gain an upside autonomy or gratification from the relationships that they will build, because this is new. This is new. There are no other networks around the country. And that is not for everybody. But that's the type of doctor we are looking for. There are plenty of doctors, and very good and well-intended doctors. I used to work with 100 of them, and they want to show up at 8 o'clock and go home at 5 and do some of their charting at home in the evening, but then truly be off when they're off. And our doctors are kind of on all the time. The difference is our doctors only have 10% of the number of patients that other doctors have. And they have such great relationships and know the patients so well that they really don't get that many after hours questions, inquiries from their patients. They educate and develop the relationships that are needed for parents to be self-reliant.
Yeah, it would mean, in my mind, as I'm listening to you articulate the transformation from the old model to the new. Instead of being a number in this doctor's practice, I am known by name and I have a relationship with my doctor and the other 10 patients or whatever small number of patients he may have or she may have. Because now it's more of a relationship that I have as a parent with my child with this physician. So I have a personal relationship with this physician and I'm not relying on the system to tell me what to do. I get a chance to talk to my physician whenever necessary. And I think it's a much different model. And I'll be honest with you, my children are much older now, but back in the day, it would be hard pressed to convince me that this is something I wouldn't do. I mean, I would want to do this for my children.
100% right. And it's not that the doctors in the corporate employed models don't want to do this. It just, the infrastructure is not there. There's such emphasis on volume and such emphasis on supporting the entire health system, which is obviously rather large in the world. It's very different. That one of the systems here in town considers your doctor to be the health system. So if you call up and you want to see your pediatrician, you may or may not even go to the same location that your pediatrician is in. You may go to a different location. If you go to the same location, you may or may not see who you consider your pediatrician. And your pediatrician may do very well, but it all depends on what's available because they want to fill every slot. That's the right business model for the health systems. So it's grown into a system that is more system-centric than patient-centric. And people will talk about being patient-centric, but it's really hard to do in a fee-for-service, volume-based model.
I would agree with that. That's interesting. And I just wrote down individual connection. That's what makes this work. And it's all about knowing and being comfortable. And this is something too, I think may get overlooked on the common mindset. And that is, a 3-year-old child gets to know this doctor and knows this doctor for how many years moving forward. They feel a lot more comfortable, and they're a lot more assured that what's happening is something that is the right thing to be happening, because they know this person. They've had the relationship with them for a period of time, and whatever is being done on their best behalf. I think it's a very different way of looking at it. And again, I don't know how many times I've taken myself or one of my children back in the day to a physician's office. I don't know who I'm seeing today. I just know I have to go here. So this is a very different model, and
Right.
I appreciate the explanation to it.
For
I
the
am
last,
curious to go ahead.
for the last 2 years, I've been saying, as you have, it's all about relationships. About a month ago, I was at the American Academy of Pediatrics meeting, and I realized it's not only about the relationships. More importantly, it's about the trust, which is what you were just talking about. So you develop these long relationships with both the kid, which is very important when they become teenagers, but the family, and they begin to trust you. And when you see different people all the time, or when you have to go to a specialist because something is wrong, you don't know them yet. You need somebody on your side that's going to be your advocate and that you trust. And it's about relationships and trust, I've come to learn.
I would agree with that. The advocate piece is a big part. I think it's a word that gets overused in the healthcare community because we're trying to not convince, but make people comfortable with, oh, I'm your advocate. But then again, I'm also part of a system. Here, in the way you've described the DPC, it's all about, I'm your advocate because I know you and I've known you for the last so many years, and I'm going to take care of you the best way I possibly can. Did I do that right?
Very good. Excellent. Yep.
Awesome. What I'd like to tap into, if we can, what are the challenges that have made this thing what it is today? Because you didn't start with wide open doors and 45 different physicians on staff are working with you. So as you grew this, what were some of the challenges that the Zest Pediatric Network has come across, and how did you overcome them? Just walk us through a little bit of that, because I think the audience wants to know, if and when you face those challenges, how do you tackle them? So walk us through it.
Happy to, and I'm not by any means going to imply that we are over all the challenges. We're 2 years old. The original practice that I was helping is 3 years old. The network's 2 years old, and we just opened up our fourth office in September, so 2 months ago. So now we have 4 offices in 2 states, 3 in the Cleveland market, and our first one in Pittsburgh in the South Hills area. So we're truly a network now, and we've become a network just over the last 10 months. So we're very new at this. The challenges are, there's the challenges in recruiting the doctors, and there's the challenges in recruiting the patients. Overarching both those challenges are awareness of the model, which is why when you reached out to me as an entrepreneur, and I do consider myself an entrepreneur and have been for years, even when I was working for a health system, I was thrilled because we got to increase awareness of this model and the opportunity. And the doctors, when we talk about this model, wow, this is what I've always wanted to do, have these deep, meaningful, helpful relationships with patients. But the challenge there is they're making a certain income, and are they going to make this income in our model? Have we proven this? How many people around the country are doing it? And I'll say, well, there's about 250 of us doing this around the country. And they're like, well, I have a mortgage. I got my kids going to school soon. And I understand that if your model works and it grows, I'm going to make more money, and I'm going to be happier, and I'll have a more flexible lifestyle. This all sounds great. Go prove that it's going to happen. So that's one challenge. So you need a doctor who is really fed up with the system, of which, as you know, if you've been reading anything about it, there's a lot of doctors unhappy these days. So that's easy to find. A doctor who's unhappy with the current system and wants to be able to serve their patients in a better way. But people who are able to take a risk or want to hustle and work at building something new, that is a challenge that we have to overcome. And we have different ways that we've thought about overcoming them. We're helping the doctors out in their first year of service. We help them with other revenue streams. There's different ways that we can help overcome that barrier. There's six of us now in this model in the 4 offices. So again, very new. We hope to continue to grow every year and eventually, yes, become national, as you said. And then there's the challenge of getting as we call them, members, or the patients, the families. And that again is awareness of the model, understanding of how this is a very affordable model. If you start to look at what does your insurance buy you in 2023, and what does the health system model deliver to you right now in 2023? So we don't have claims data, which is the way actuarials and employers evaluate the cost of care for the people that are covered. In the direct primary care world on the adult side, many studies and actuarial data that show it can save employers 20%, 25% on their healthcare expenses, because these relationships end up in the patients having less referrals for imaging, for specialists, for urgent care, for ED. For all the reasons we've already talked about, the doctors better care for their patients. We don't have that data in pediatrics. So one thing we started to do is we surveyed patients and we asked them, because of this model, have you avoided in-person visits that you would have had in the traditional model? 90% of our patients have said they avoided office visits because we don't need to bring them in the office. There's no incentive for us to bring a patient into the office. We can manage them through text, through pictures, through video, go to their homes. We get paid the same either way. So 90% of our members say they've avoided an office visit. 80% say they've avoided an after-hours urgent care visit, weekend or evenings. And 70%, which blows my mind, but 70% self-report that they think we have kept their child out of the emergency department.
Wow.
And if you just start to extrapolate those savings, the membership pays for itself. And what we failed to do, and we will with the next survey, is ask families, have you missed less work? Has your child missed less school because of this model of care? Has it been more convenient? When you have an appointment with one of our doctors, you show up, your doctor's there, they greet you, and you go in. We have no staff. The doctor's there. You don't wait in a waiting room. You don't wait in an exam room. The doctor sees you. So it's the convenience factor is we also can't quantify. So again, it's awareness, and for families to understand all the benefits that they're going to have in this model. Those are our challenges because it is so foreign to people. I'll stop at 1 second. One other thought is, if you think about the most ideal patient for us, I'm not sure that's the right term, but one of our targets are brand new moms, because that's where we can really start to make a difference right from the get-go, where we do a prenatal home visit, we do home visits after the baby's born for up to 4 months. We can really begin to make a difference, but they haven't experienced all of the challenges in a traditional fee-for-service practice yet. If they're a brand new mom, they haven't waited in their waiting room, with their healthy kid, let alone their sick kid, waited in the exam room. Now they have as an adult with their own doctors, but the challenges are very different. They haven't been concerned at 8 o'clock at night about their baby and have to wait on hold with the answering service and then call a nurse and et cetera before they can reach their doctor. So we're trying to proactively explain to them the pain points in the current system and how our model is better. If they already have had those pain points, it's pretty easy to convince people, as you say. A lot of adults who've already had their kids grown up and move out say, "Oh, I wish this was there when we were."
Yeah, which is good to know, because eventually my children are going to be their own parents of their own children. So the knowledge that this is available, and it's literally reestablishing the healthcare model, I think that bodes well for your success moving forward, because there's going to be a group of educated children that are going to be parents that are going to learn and want this for themselves. We have been rattling on for quite some time now, and we've got a couple minutes left. I would love to ask you a couple questions, if you don't mind, about you. If you had a chance, Drew, to go back to the 18-year-old self, what advice would you have for 18-year-old you?
That's a great question. I didn't realize how little you know. and that you need to realize how little you know and set yourself up for the expectation of lifelong learning. Don't think that you're going to go to school for 4 years for college, and then somewhere halfway through college say, oh, maybe I want to be a doctor, and then decide you're going to go to med school for 4 years and your residency for 3 years and think you're going to be done learning. I never want to be done learning. One of the reasons I left my other job is I was no longer felt like I was being stimulated and challenged. I could no longer help doctors, and I felt that I wasn't growing. And as soon as I made that decision to leave and be more independent and entrepreneur, I'm so happy again. So happy to be learning. Every day I'm learning something new as an entrepreneur, and also in medicine, because my boundaries are lifted. I can think more globally about the patients. And so I would tell my 18-year-old self, be prepared for lifelong learning and figure out how best you learn so you can do that.
If I may add, based on what I've listened to, you would tell your 18-year-old self, you know your passion and follow it. Yeah. Because you clearly, it exudes through the camera how passionate you are about this. And I give you a lot of credit for taking the risk to build something brand new and bring this to the marketplace, because it will make a difference. I am convinced of that over the last 15, 20 minutes talking to you, that this is a revolutionary way to take care of pediatrics. And eventually it's going to be widespread and people are going to adopt it, because it is, as you laid out, it's less expensive. You get better care. You have a good trust advocate relationship. The parents have a better convenience. And in the long run, the outcomes will prove that patients in this network are better cared for and become better young adults. That's my stance. I'm sticking to it.
Well, we're hiring you as a spokesperson because we believe that too, and I'm glad that I could convey all that to you in such a short time.
Not a problem whatsoever. It's been my pleasure. And for those watching, in the description down below, we'll have all the website information and contact information for the Zest Pediatric Network. And if you want to get in touch with Dr. Drew, by all means, go ahead and do it. And you can do all that by clicking the description or the information in the description below. Dr. Drew, thank you so much for your time. And I really appreciate it. We'll see everybody again on the next episode of the Business Spotlight.
Thank you, Scott. Appreciate it.